Joining us right now, Representative Tom Price. He is a doctor from the state of Georgia. Representative Price, thanks for joining us. I want to ask you about your plan. You know, everybody says Republicans, all they do is criticize Obamacare, but they don't have a plan. Well, you've got a plan. You've proposed it 3 times already. I want to get into your plan in a minute, but I got to ask you about the latest news here. It turns out, based on a memo that was released by the Committee on Energy and Commerce, that Kathleen Sebelius, the Secretary of Health and Human Services, attended a briefing on April 4th. And at that presentation, the people who were rolling out this website said there is insufficient time to do the kind of end-to-end testing that's required for this launch. They recommended a limited initial launch. She knew that this website was not ready. She knew that it was going to be a disaster. 2 weeks after getting that briefing, she told the Republicans on that committee that everything was, quote, on track and on time. At this point, Congressman Tom Price, should Kathleen Sebelius step down or should the president fire her?
You mean you're telling me that somebody in the administration actually didn't tell the truth? Look, this is a repeat offender. In healthcare, I'm a physician. In healthcare, if you do those kinds of things, it's called malpractice. I said at the time that this law was being passed that it was legislative malpractice because they were deceitful in putting it through in 2009 and 2010. I don't know who should resign. It's up to the president to determine whether or not he has confidence in her. But clearly, these folks have no idea the havoc that they're wreaking, not just on economies and financial situations for folks, that they're wreaking on people's lives. This is real stuff, and they're damaging people's lives, and it's time for the president to say, this clearly isn't ready. We're going to delay this thing.
All right, Congressman, I want to drill down on something that happened late last week. You had this vote in the House of Representatives on Freddie Uptons' bill, Congressman Uptons' bill. He came up with a Republican fix to the problem with Obamacare, which is a lot of people are finding out that they can't really keep their health care even if they like it. The Democrats had the presidential fix, and 39 Democrats went with the Republican plan. Now, I have heard it said, and I want to know if this is what your view from Capitol Hill, that if the president had not thrown up this fig leaf and perhaps given Democrats some cover, that there would have been a lot more Democrats prepared to defect and to take sides with the Republican proposal.
Well, I think that's absolutely correct, and the president was floundering last week, just like he's floundering this week on his law, again, that's destructive to individuals' health care. And so 39, I thought, was really a small amount that should have defected. Everybody who looks at this who has the least amount of objectivity can clearly see that this law isn't working and that it's harming real individuals in real ways. And it's all the more sadder and tragic because there are wonderful, positive, patient-centered solutions that we could put in place that would put patients and families and doctors in charge and not the president in the United States or Washington, D.C.
All right. Can you recall another time, however, when you've seen political fortunes turn so quickly?
It's tough.
I can't recall that.
I don't think I have because it's not just it hasn't been short-lived, and it's not just in a focused area of the country. I guess you could say that Toronto mayor's fortune turned rapidly.
I don't know. He's still pretty popular. He's more popular than Obama right now. All right. Congressman Tom Price is our guest. And you just a couple of minutes ago, you were advising that the president at this point should cut bait here and say, listen, this thing is hurting people. It's actually doing more harm to healthcare in America than good. And you think that he should just, call a halt to Obamacare. And I can hear the people on the left. I'm hearing all of your opponents across the aisle saying, oh, sure, you Republicans, you just want to criticize the president, but you don't have your own plan. Representative Tom Price, please tell me about the Empowering Patients First Act.
Well, H.R. 2300, the Empowering Patients First Act, this is the third Congress that we have introduced this piece of legislation. When Obamacare was going through, I asked weekly, as chairman of the Republican Study Committee at that time when we had this legislation, to meet with the president, because the president kept saying, if anybody has a better idea, just let me know. I'm happy to sit down and talk with you. We asked every single week for a whole year to sit down and talk with the president. We never got a positive reply. Our bill, H.R. 2300, would get folks covered, every single American covered with insurance that they want, not that the government forces them to buy through a series of deductions, credits, advanceable credits, refundable advanceable credits. Would solve the insurance challenges of portability and pre-existing. You ought not lose your insurance if you change your job or you lose your job. people ought to be able to own their insurance coverage regardless of who's paying for it. So if they change their job, they lose their job, they simply plug it into where they end up. Pre-existing illness, nobody ought to be priced out of the market because of a bad diagnosis. That's a system that respects either Washington or insurance companies, but not patients. That's a bad system. There's an easy way to fix that if you allow all those folks that are threatened by that is those in the individual and small group market, to be able to pool together with the purchasing power of millions so that any one individual's adverse health status doesn't drive up the cost for anybody else.
All right,
the way that
Representative Price, I'm sorry for interrupting you there. I just wanted to get you. I hear you, and it sounds great. But back in 2009, when you proposed this, Ezra Klein over there at the Washington Post, he's kind of a wonky little dude who calls himself a healthcare expert. He said that the problem with your proposal is there is no individual mandate. There's nothing forcing people to get insurance. So you're basically putting it out there, and then you hope people will get insurance. How do you respond?
Two things. One, our proposal makes it so that if there's a financial incentive, it makes more sense financially for every American to be covered, and people will make the right decision. Second, the individual mandate, the problem with the individual mandate is that once government mandates something, it has to define what it's mandating, and that's where the rub is when, if you like what you have, you can keep it, lie was told. Because once the government defines what health care is, then it defines what health care isn't, and if what you have in your insurance coverage isn't what the government thinks you ought to have, it won't be available, and we're seeing that roll out right now.
All right, so what's going to happen? Because, this legislation came out of the House. It's not going to go anywhere in the Senate. Many people say the president's fix is not a fix at all, that he doesn't have the authority to do it. Aren't we sort of where we were about a week ago?
Well, we are, except that more of the American people are recognizing that the president didn't tell them the truth, and that this law is destructive to their own health care. I've seen interview after interview, and we get communication to our office daily by individuals who say, kind of as an apology, look, I voted for the president, but this is the wrong thing to do. And that's what's going to happen. The American people in big numbers are going to recognize that this is harmful to accessibility to health care, affordability to health care, quality health care choices, all the things that the American people want. And they're going to say to the president, I think in big numbers, stop the madness.
All right, Representative Tom Price, good to have you. You have a press office there in your office. How many media requests are you getting about your alternative to Obamacare? I'm guessing Rachel Maddow's all over this because she's interested in good government, right?
Yeah, right.
Well, more now than before. Anybody, again, that has a sense of objectivity about it knows this doesn't work, and we should put patients and families and doctors in charge, not Washington,
right.
D.C.
One last question on your bill, Representative Price. How many millions and millions and millions of dollars do we have to spend on the website for your plan?
Zero, and you don't have to raise your taxes by a penny.
It was kind of a softball. Thanks, Congressman Price.
That's what you call an easy question.